You ready for some education? What is sleep apnea? To understand what sleep apnea is, first we have to understand sleep. An uninterrupted 7 to 9 hours of sleep each night gives our bodies and minds time to recharge, throw away images that we do not have to remember, but more importantly, it puts the memories that we do need to remember into long-term storage in our brain. In order to do that, which happens mostly in REM sleep, you have to go into multiple different REM cycles. More about the stages of sleep in a bit. An uninterrupted 7 to 9 hours of sleep gives our body enough time to get into those multiple REM stages and for your body and brain to do what it needs to do so you have a focus next day with a clear head and the energy that will take you through the day. There is no pill, no therapy, or doctor visit that is more important than 7 to 9 hours of solid sleep for your overall physical and mental health, not to mention the negative health effects associated with a lack of sleep like high blood pressure, heart disease, and stroke. Sleep apnea is a common sleep disorder. It is characterized by multiple pauses in breathing during sleep. The pauses can be short, as few as just 10 seconds, to as much as a minute or more. The most common kind is obstructive sleep apnea. The airway becomes blocked, most often by throat muscles that are too relaxed. Central sleep apnea happens when the brain is not sending the right signals to the breathing muscles. Snoring is a very common symptom for sleep apnea, but not every person that snores has sleep apnea. In each and every one of those breathing pauses, the oxygen levels in your blood start to decrease. And because humans are so remarkable, one of the things that is built into us is what we call the arousal index, which wakes us for a variety of important things, including low oxygen levels. The best range for oxygen is over 97%. Even a small drop of a few points is significant to the brain and body and happens very quickly when breathing is compromised. The arousal index is just trying to protect us and keep us healthy. So when your oxygen levels start to fall, that arousal index is triggered and it wakes you up out of sleep. Then you can actually open up your airway and take a full breath. Then your oxygen goes back up to normal and you'll fall back to sleep. That process happens usually in as little as 10 seconds, but it takes a full 30 seconds for us to be aware that we actually woke up. So every time that your oxygen starts to fall because of an airway issue, that arousal index wakes us, you take a breath, and then you go back to sleep. But you likely don't remember any of that happening. Why is that so detrimental? Well, because every time it wakes you, you're not staying in the stage of sleep that your body needs to be in at that moment. That results in interrupted sleep and fragmented sleep. And then you don't have enough time to get into all of the stages of sleep that our bodies need. There are 4 stages of sleep. Stage 1 is a transition from wake to sleep. Stage 2 they call like a filler sleep. We can dream slightly, our heart rate and breathing slow, and our body temperature drops. Stage 3 is what we call our slow wave sleep, and that is your body's physically restorative sleep, like muscles regenerating, cartilage regrowing, and when our hair and nails grow the most. Then we have REM stage sleep. REM stands for rapid eye movement, and that is your mentally restorative sleep, which prevents crabbiness, irritability, memory issues, compromised cognitive skills, depression, anxiety, and many more things. All stages of sleep need to happen, and they have to happen at least 3 to 4 times each night to get the kind of refreshing sleep that our bodies need. Anything that disrupts the body's natural ability to get good quality interrupted sleep is a problem. Low oxygen can cause the arousal index to get triggered, but also periodic leg movements, severe pain, or a person noise physically waking us. But a high percentage of sleep interruptions and fragmentation at night is from our oxygen falling. That's where a CPAP device is needed to keep the airway stented open, which stops any drop in oxygen, so then that arousal index never gets triggered and you will get into all the different sleep stages that your body needs. CPAP stands for continuous positive airway pressure. It stents the airway to keep it open. Who has sleep apnea? Well, the conventional wisdom is, I'm not overweight, so I don't need a CPAP machine. Out of the 10,000 or more sleep studies that I've done in my career, or the thousands of setups that I've done with CPAP devices and looking at sleep studies, I would say a good 40% of those patients were at their ideal weight or underweight, yet had different degrees of severity of their apnea. Now, being overweight usually makes the problem of sleep apnea a lot worse, but it does not mean that being at your ideal weight, you can't and don't have an issue. When you're awake, you're upright, and gravity is not pushing down on your neck and your muscles, you take full breaths and your oxygen levels are always where they need to be. When we are laying down and relaxed with the flabby soft tissue in the back of our necks and gravity, that's where it becomes an issue. How do I know if I have sleep apnea? And that's a great question. There are 3 ways that you can be diagnosed with sleep apnea. The traditional way is going to a pulmonologist or a sleep specialist office and telling them your issues with your sleep. And he or she then schedules an in-lab sleep study with a registered sleep technologist, which looks at the stages of sleep, your heart rate, leg movements, and oxygen levels. The second way is a home sleep study, where instead of all the electrodes and looking to see what stages of sleep you're in, the home study relies more on just airflow, effort, and your oxygen and breathing from a special oximeter. The third way, which most people can do on their own at home, is simply getting an overnight oximetry unit that clearly states that it does a second by second reading of your oxygen levels. The reason this way works so well, again, is that your oxygen levels should never fall. So if it's picking up 2 and 3% or more drops in your oxygen levels throughout the night, there is only one thing that causes that, and that is some form of sleep apnea. How can you assure that while you are unconscious and you're sleeping anyway, right? That you have a productive night's sleep that is healthy and refreshing? Well, first, by getting tested to see what happens while you're sleeping. We don't know what's happening while we're sleeping. Does your oxygen fall continuously? Does it ebb and flow instead of being more consistent throughout the night? If the testing does show fragmented sleep or frequent oxygen desaturations, then using PAP therapy or positive airway pressure is the gold standard, since your airway is stented open from the air continuously going in. The airway does not collapse, and the arousal index then does not get triggered. There is also an APAP, which is just like CPAP, but it's an auto-adjusting level. There's a BiPAP, which is both an inhale and an exhale of the pressure. And then there's even more sophisticated machines like ASV, which is an auto-servo ventilator, and that's primarily for people with central sleep apnea.